distinguished speakers, delegates to the Commission on the Status of Women, dear ladies and gentlemen, I would like to welcome you to this afternoon's event on the theme Affirming the Human Dignity of Rural Women and Girls through Healthcare and Education. Respecting the dignity of woman means accepting and valuing her at the level of her full humanity, including the maternal meaning of her femininity and the innate patterns of her fertility cycle. Various contemporary approaches to what is referred to as sexual and reproductive health and reproductive rights do not respect this full dignity of the woman, thereby failing to reverence the motherly aspects of a woman's body and personality and undermining her holistic development.
At the Commission on the Status of Women, it is often said that for women to be empowered, they must be able to control their fertility. And those who say this normally mean that women and even young teenage girls must have access to and use of contraception and sometimes abortion. But the UN's own research confirms that contraception won't meet the needs of women who don't want to use it for a variety of reasons. Rural women sometimes suffer from a lack of medical care and an inability to link with experts and specialists as needed. We have already seen this lack of access among FEMM app users, many of whom wish to be linked to FEMM doctors. Technology is allowing us to bridge this gap, and we are currently working to develop telemedicine care that will allow us to bring healthcare to rural women everywhere. Dr. Nkechi Asogwa runs Doctors' Health Initiative in Nigeria. They work to serve the poorest of women located in rural displaced persons camps, many of whom are victims of Boko Haram. You'll note they're eager for this information, they're ready to be educated about their cycles, and they want to be given the tools they need. And you'll see how creative they and the doctors have been to find those tools so that they can monitor and chart their cycles and hormones and understand when things are fine and when care is needed.
Rana ta biyu kuma sai ki cire ganye akan na biyu din gaba ki daya. The third day, the next one. Sai na rana ta uku ki zo ki cire wannan din kuma duka gaba ki daya kai. Now, after some when you see the blood finish, when the blood finishes, you now have some days when sai kar ki cire ganye akai ki bari. So those dry days, we count dry days too. Let's say this is the first dry day. Second dry day, third dry day. Now by this
wanda aka yi nan kuma da kuma ya taimake ni sosai da aka yi magana aka yi koyarwa akan bi al'ada nan to gashi nan na fado ciki kuma an taimake ni ga yadda za a yi.
Despite the work that has been done, there is still much work to do.
The primary goal really was to provide easy access to education and health care for all women. When we built the technology, or while we're building, we paid attention to all types of women. One of the major things we realized really fast is to reach all types of women, we need to be able to translate the apps to different languages. We're thinking about women who may be in rural settings where smartphones are limited. In a village, you may have only one woman with smartphone. So what we thought about is allow different women to be able to log onto the app. So the goal is to reach every woman.
It is very common for women to suffer in silence, either because reproductive tract infections are common or because they are ashamed. This culture of silence, synthesis, and cultural norms about the woman's health and related problems in Bangladeshi society inhibit women from seeking necessary medical care. FEMM is not only just as effective, but also more attractive because it does not risk any unpleasant side effect and because it empowers women to monitor their health. And investigation of high contraceptive discontinuation rate consistently shows that women want a method that is both effective and free of side effect.
Our healthcare model at Holy Family was really forged by the various orders of courageous nuns who started Catholic healthcare in America. It's designed on the historic healthcare paradigm that includes the emphasis on education and relationship, specifically the dignity and beauty of women created in the image and likeness of God. Our program has adopted a woman's monthly cycle as the fifth vital sign, It's a reliable sign of health or illness, similar to a pulse or a blood pressure. This education for women is truly essential in a knowledge-based healthcare program. With this education, women can maintain the highest standards of personal and reproductive health from puberty through menopause. What we're discussing today isn't a supply chain issue, and it's not a technology issue. It's really a human issue. And it's a human issue that needs to be solved by humans, across cultures and across faiths. Thank you very much.